Hi everyone. Today we're talking about root canal treatment. Is it better to have a root canal treatment or to just remove the tooth? Well, it depends. It depends on the prognosis of the tooth. It depends on the finances as well, because the root canal can be quite expensive. In many cases, saving it is better because you then you keep your tooth instead of removing it. Because later on you're still going to need to do some implants to replace the tooth. So it depends on the prognosis of the tooth. Can it still be saved or salvageable? Depends on your health, your general health as well. It depends on the finances involved as well, and also mostly the finances. But I would say saving the tooth is much better when you're doing a root canal treatment, because you keep your tooth instead of having to remove the tooth and then have implants or dentures later on. Because I've had some people say that dentures are quite uncomfortable and implants tend to be even more expensive than a root canal treatment itself. So I would say rather have a root canal treatment and save your tooth. So the advantages of keeping your tooth by doing a root canal treatment: you'll have your smile, intact. You won't have any gaps. You preserve your bone, because obviously once you remove the tooth, then the bone collapses, and you save money in terms of doing implants later on or having dentures. You also prevent your tooth from collapsing in the space where the tooth was removed, because I've realized that people, after removing the tooth, they take time to really close the gaps, more especially when the teeth that was removed is at the back. You can still eat with your tooth because obviously you need it for eating. You can use it for smiling as well. So those are the advantages of doing a root canal treatment to save your tooth. The disadvantages are not every tooth is salvageable or savable. Some are susceptible to breaking later on, because most of the time teeth that need root canal treatment are already severely damaged. So if you have done a root canal treatment, I'm sure the dentist would have explained to you that you might need a crown later on, just to make sure that you protect your tooth in terms of fracturing, because mostly 80% of the tooth structure is gone. So in order for you to have a tooth that has evenly distributed forces, occlusal forces, when you're biting, then a crown covers the tooth in all the surfaces, and when you're chewing, then the forces are distributed evenly, and then your tooth won't have any issues with the fracturing in the future. Another thing is that because most of the teeth are fractured, most of the teeth that need root canal treatment are fractured, you might need extra treatment like the crown lengthening, just to have enough tooth structure to fill up the tooth. And then another disadvantage can be the cost then involved into having the root canal treatment. So with the fractured tooth, most of the time they might need the post build-up, the core build-up of the tooth before doing a crown or just saving the tooth. So it's most of the time it's the cost, and then if you have the crown on it, then it's less chances of having the tooth to break, which is mostly the issue. The disadvantages of having a root canal treated tooth is the fracture in the long run if it's not crowned. And again, I'm not saying that every tooth that has a root canal needs a crown later on. Most of the time they do, but the dentist will tell you. So having a root canal is best when the patient wants to save the tooth. The tooth structure is still sufficient. Also, generally your health is good to be able to sustain the root canal treated tooth and not reject it. There's still enough bone support. Even if it's fractured, the crown is fractured, it's possible for a crown lengthening of that particular tooth to be done and to do a crown on it. Basically, it's always best to go for a root canal when the tooth structure is still good enough to be able to save the tooth. But in cases whereby it's not good enough and the dentist will tell you, then just go for the extraction. So what about then just doing an extraction? You could, if the tooth is severely damaged and there's absolutely nothing you can do about it, and if you feel like the costs are just too expensive for you to do a root canal treatment, and you are comfortable with doing implants later on, or doing dentures later on. So in instances where the infection is so severe that you can't even wait for the antibiotic treatment to work and then come back in a few days, 5-7 days to do a root canal treatment. If you just want instant release, then it's good. Extract the tooth. Extracting the tooth, it's at that particular point, because you want to relieve the pain, seems to be like a reasonable thing. But just think of the cost later on that accumulates, where you have to do the implant, or you try the denture, you're uncomfortable with it, then you have to do the implant, and the maintenance of the implant, which is more cumbersome than just the maintenance of your actual tooth, because you use your tooth and yeah. But in instances whereby you've done a root canal treatment, but there's repeated failures, like I said, the body can reject the root canal and some other underlying diseases as well in the body. In such instances, then the root canal is non-negotiable. Extracting the tooth is non-negotiable. Just remove the tooth because the body is rejecting it. All right, I hope this helps answer your questions that you've had. But if you feel like there's a question that I didn't answer, please comment below and give me questions. Then I can tackle your questions. Thank you for tuning in.